I'm Dr. Jeremy London. I am a board-certified cardiovascular surgeon, and I've been in practice for just over the last 25 years. And we spend a lot of time on this podcast and on our platform in general talking about prevention, how to be proactive and not reactive with your healthcare, and specifically with cardiovascular health. I want to deviate for just a moment and get a little more down the rabbit hole, because I think it is important to understand what your options are if you do end up in a situation where you're told that you have blockages in your heart arteries. Why is this important? Well, heart disease, specifically blockages in the heart arteries, is the #1 killer of men and women across the world. It claims over 19 million lives each year. So even though this may not apply to you directly today, it is an important issue that we are all at risk for, quite frankly. So even though you might say, well, I'm doing pretty well and I don't have blockages, it's always nice to know what if. Because when you are faced with this challenge and a physician tells you have blockages, it's scary. You really feel like the ground has shifted underneath you. And so I think to have some framework is worthwhile. Today, we're going to really talk about the broad brushstrokes. We're not going to get super granular, but I want you to understand what the three major buckets are, what your three major categories of choices are, depending on where you fall on the spectrum of coronary disease and how that impacts your decision making. And those are as follows. The first is lifestyle changes and modifications with medications. The second is stenting, or what we call percutaneous intervention to blockages in the heart arteries. And the third is open heart surgery or bypass surgery. And as you might imagine, these are being discussed from least invasive to most invasive. Now, realize these are framework protocols. So if yourself or a family member has undergone treatment for blockages in the heart arteries and it doesn't fall exactly in one of these three buckets, you haven't been treated incorrectly necessarily. You just have to understand that protocols are guidelines, and they have to be individualized for each patient, each given situation. The goal today is to give you an overview of what happens if a physician tells you that you have blockages in the heart arteries. We want to take a minute and thank our sponsor of this podcast, Element. Hydration isn't just about drinking more water. It's about replacing what you lose. When you sweat from workouts, sauna sessions, or just daily life activities, you're not just losing water, you're losing electrolytes like sodium, potassium, and magnesium. That's why I choose Element as my electrolyte replacement of choice. Element has everything you need and nothing you don't. Their electrolyte formula uses a science-backed electrolyte ratio of sodium, potassium, and magnesium. Electrolytes are used by every cell in your body, and even minimal dehydration can limit cognitive and physical performance. Element tastes great and helps me replenish my electrolytes after a hard workout or sauna. I mix 1 packet of Element, usually my favorite flavor, grapefruit salt, in 32 ounces of water to ensure I stay hydrated throughout the day. If you want to try Element for yourself, head to drinklmnt.com/London and you will receive a free sample pack of all 8 of their most popular flavors with any purchase. That's drinklmnt.com/London. Plus, they offer an unlimited time, no questions asked refund policy. So if you buy it, try it, and don't like it for any reason, they will refund you. Now let's get back to the podcast. I always think it's worthwhile to start with the basics when we're talking about these potentially very complex situations and decision making. And in this case, when we're talking about blockages in the heart arteries, we first need to understand the heart arteries and how they function and how they work. Now, the heart arteries themselves actually run on the surface of the heart itself, and they have branches that go down into the heart muscle to take oxygen and nutrients to the muscle itself so that it can perform efficiently. There's basically 3 territories: the front, the side, and the back. And the front and the side are split into the left system, and the back of the heart is the right system. So we have 2 main coronary arteries, the left and the right, and those then branch to carry nutrients to the heart muscle itself so that you can basically fuel the heart pump so that it can continue to work appropriately. So what's the problem? Well, the problem is blockages in the heart arteries themselves. Blockages typically build up as a result of cholesterol and plaque formation. There's a wide spectrum between soft plaque and hard plaque. Many of you are probably familiar with these terms. We're not going to dive into that today. We're going to talk about the basic problem, which is this. Because these heart arteries are the roadways, if you will, to get oxygen and nutrients to the heart muscle, if you have a roadblock or a blockage, the heart muscle below that blockage becomes blood starved. Nutrients and oxygen cannot get to that portion of the heart muscle. As a result, you can either have early signs, shortness of breath, mild chest pain with exertion, because as you exert yourself, the heart's working harder, and you then outstrip that area of the heart's ability to be able to get adequate nutrients there. So your heart is giving you warning signs. To the end of that spectrum, if that artery were to totally block off and result in a major heart attack. The problem that we're trying to solve here is to maintain an open highway, open arteries, so that all 3 territories of the heart are receiving adequate oxygen and nutrients to prevent any symptoms when you are doing activities of daily living or exercising or whatever it may be, and most importantly, to prevent a big heart attack so that you can live longer. So let's dive into the first bucket, which is lifestyle modification and medications. And it might sound a little counterintuitive since we're talking about an actual roadblock. You would think we better clear that roadblock. And that, in fact, might need to be what happens. But if you're in a low-risk category, meaning you have blockages but no symptoms or very, very mild symptoms, then the first and least invasive choice is, number 1, to make lifestyle modifications and add appropriate medications. What are those lifestyle modifications? Well, they're ones that most of us or many of us are very familiar with. The first is to focus on a healthy whole foods diet where we limit saturated fats, try to maintain appropriate glucose control by limiting extra sugars and carbohydrates, and really focusing on a solid nutritional plan to help us maintain our overall physiology. Second is movement. For sure, aerobic training and strength training move the needle significantly when we talk about lifestyle modifications. These then help the body's ability to maintain both glucose and lipid management, cholesterol management, as well as increase the efficiency of the heart itself when you're doing aerobic training. In addition, recovery is key. This is where the magic really happens many times. Sleep is critical. Having a solid sleep hygiene program is something that I personally struggle with but continue to work on. And it's many times kind of the unsung hero where people are really working hard on their nutrition and their fitness, but don't give themselves time to actually recover. And finally, of course, is the importance of relationships in our lives and maintaining good connections with other people. Those are the major pillars, the major levers of lifestyle modification. And these are whether you're given the diagnosis of blockages in your heart arteries, or that goes back to our normal mindset on the platform, or our more common mindset on the platform, which is prevention and how to be proactive and not reactive. But it's the same model now that we are in a situation where we are told that we have blockages. And I was in that situation 3 years ago where I was told that I had blockages in my heart arteries, and I thought that I did a pretty good job with all of my lifestyle choices, but I had to tighten them up. And so we can all do better. So even though you might think you check all of those boxes, it's always good to approach this with a fair amount of intellectual honesty, because typically we can all do better. From a medication standpoint, what we're looking to do is really three things. The first is to decrease the amount of stress and strain that the heart is under. And this is done with medications to treat high blood pressure if you have that, and to lower the heart rate so that the heart can beat less, essentially, and more efficiently. So we're taking the stress and strain off the heart with medications, number one. Number two is cholesterol. We know that LDL-C and specifically apolipoprotein B, the particles that can actually attack the vessel wall, are causal for heart disease. So evaluating your ability to take statins or alternatives to statins with your physician is incredibly important, because we want to decrease the amount of particles that are actually circulating to continue this process of creating plaque in your arteries. And third is treating your metabolism or your physiology by maintaining a healthy glucose level throughout the day. This can be done exclusively with diet, but occasionally medications are needed to really stabilize your glucose levels. So lifestyle modification and those three aspects of medical therapy is the first tier for treatment of cardiovascular disease, blockages in the heart arteries where you have no symptoms or very low-level symptoms, which means you have a low risk of consequently having a heart attack. So we're trying to really shift the needle here away from the heart attack spectrum and essentially hold you where you are, if you will, because we don't get regression or removal of the plaque as a result of these medications and lifestyle changes. We'll get back to the podcast in a minute. We want to thank today's sponsor, Manacora. Manacora makes the best honey on the planet. Manacora's raw, glyphosate-free honey is exclusively harvested from the Manuka tree in New Zealand. What's the difference between regular honey and Manuka honey? Well, Manuka honey offers 3 times the antioxidants as regular honey. Manuka honey contains MgO, or methylglyoxal, which is an antibacterial compound. The higher the MgO content, the higher the concentration of beneficial bioactives. Manacora's honey is rich in high levels of antioxidants and prebiotics, which support digestion, gut health, and immunity. Each batch is third-party tested to ensure the highest level of purity. My favorite part is that it tastes amazing. It is hands down the best honey I have ever tried. I enjoy mixing Manuka honey in plain Greek yogurt, on a banana on the go, or even in a shot of espresso as an awesome pre-workout. If you want to taste the difference for yourself, go to manacora.com/London to get 31% off plus $25 in free gifts with the starter kit. That's manacora.com/London, or click the link in the description. Now, let's get back to the podcast. So what happens if lifestyle modifications and medications don't work? In other words, you've instituted all these things, you've followed the plans appropriately, but you continue to have symptoms or you have progression of the blockages. Well, the next level of invasiveness is stenting, or percutaneous intervention of the coronary arteries. Well, what is stenting? So this is done from inside the arteries. Your body is accessed either through an artery in the groin, the femoral artery, or more commonly these days, in the way that I had it done actually, was through the wrist. So a small catheter is then fed under x-ray guidance from the wrist or the groin all the way to the heart. And then they engage those left and right main coronary arteries that we reviewed in the basic anatomy and then put dye in those arteries and take x-ray pictures of where and how that dye flows. By doing that, you can find the very precise location of where the blockages exist. A wire is then passed beyond that blockage, and a stent that's loaded on a balloon, again under x-ray guidance, is passed through that same artery into the main coronary arteries in the heart, across the level of the blockage, and then the balloon is expanded. Now, what this does is it actually cracks the blockage, the plaque itself, and when the balloon is deflated, the stent remains expanded to hold that area of the artery open. This then releases the roadblock, opens the blockage, and reestablishes flow to the area of the heart muscle that was blood starved. Now, the wonderful thing about stenting is that it is minimally invasive. When I had mine done initially, I asked for no sedation. Apparently, I got very annoying and asked too many questions of the cardiologist during my procedure, at which point he immediately sedated me so that he could concentrate on what he was doing. But that would be the norm. It's kind of like having a big dental procedure or something of that nature. So you're not put all the way to sleep. You are aware of what's going on, but it doesn't hurt. You typically spend a night in the hospital, and you're home the next day with some minimal limitations for 4 or 5 days, and then you're back to your regular activities. It does require blood thinners or antiplatelet therapy, which usually is aspirin and another medication like Plavix, which is essentially a turbocharged aspirin. And you're on both of those for about 6 months, and then you continue on aspirin for about a year. And the reason for that is you've got a metal stent that's now expanded in that artery. A metal stent inside the artery is recognized as foreign by your body. So there's a tendency for your body to collect clot in that area. And by staying on these medications, you lessen the likelihood of that occurring. Stents are very successful, particularly when patient selection is good, and they really work, particularly when it comes to symptom relief. And when stents are combined with lifestyle modifications and medications, there is a significant benefit for overall longevity. Now, stenting does have certain limitations. Typically, location of blockage is very important. There are certain locations in the heart where it's just dangerous to stent, or the amount of calcium or the complexity of the blockage may be as such that a stent isn't appropriate. And in general, if you have more than 2 arteries with blockages, stenting then becomes a gray area. That's just because it's difficult to predict how a stent is going to act in multiple arteries. If you have a large artery with a very pinpoint or focal blockage and you put a stent in there, they typically do really well. But if you have what we refer to as more diffuse disease, where multiple vessels are involved, the outcomes become a little more gray. There are certain instances when multiple arteries are stented, but the general guideline is 1 or 2 arteries is appropriate for stenting. Once you get over 2, we need to consider the next level of invasiveness, which would be open heart surgery. It can entail many things, but in this case, we're talking about bypass surgery, referred to as coronary artery bypass surgery. In other words, we're bypassing the blockages in the heart arteries. Unlike a stent, where we're opening it from the inside, we're essentially rerouting the plumbing around the roadblock. How do we do this? Well, it's done through an incision either in the center of the breastbone or off to the side. And the tubes that we use, or the new plumbing conduit that we use, can come from a variety of places. We harvest an artery from behind the breastbone to do bypasses, an artery from the forearm, on the thumb side of the forearm, and we can harvest vein or remove a superficial vein from the leg utilizing an endoscopic technique to then use these tubes to perform these bypasses. It is a very invasive procedure. It takes about 3.5 or 4 hours to perform. It can be performed either with or without the bypass machine. We can leave the heart beating in certain instances. In other instances, it's safer to stop the heart. But the advantage is we can address multiple blockages, and because we're not dealing with the complexity of the blockage from the inside, we're going to bypass down to more normal artery. We can deal with very complex lesions or lesions that were too dangerous to be stented previously. So although you don't get to go home the next day like you do with stenting, you do stay 3 to 5 days in the hospital, and it takes several months to fully recover. The benefit is that if you fail medical therapy and you fail stenting, in other words, you get a blockage in the area that was stented very early, or you're not a candidate for stents very early on, you have 2 or more blockages, high complexity, location of lesion, bypass surgery offers the best long-term results in that case. Bypass grafts typically last 12 to 15 years. It just depends on whether or not patients are willing to take responsibility and continue lifestyle modifications and their medications. In addition, some people just have very aggressive coronary disease, and whether it's stenting or bypass surgery, it really takes multiple modalities to treat the problem. But from a long-term standpoint, bypass surgery is really the best long-term option for multiple blocked arteries or complex disease. Just to clarify and to touch again on a point that I made at the beginning, these decisions are individualized as far as maximizing your benefit and minimizing risk. In other words, what's the best choice for you as far as a sustainable, durable therapy? You may have fit into one of these buckets, or someone that you care about fit into one of these buckets, and it makes perfect sense. But I don't want you to feel like, well, I had that and I got something different. That's okay, because each individual clinical scenario has to be evaluated specifically. And so these are very basic, broad brushstrokes of the major buckets of decision making. And just because you didn't fit exactly one of these categories that I have just laid out, these are the American Heart Association overriding guidelines to give physicians and patients general direction. And then from that point, the therapy is tailored based on the patient's overall physiology, how healthy or not they are, the anatomy, how old they are. There's so many factors that go in. This is not to give you absolute black and white decision making. So I don't want you to worry that either that you haven't been treated properly or that a poor decision was made by either you or the physician as far as how the treatment plan progressed. This is an individualized process, and this is a basic framework. One of the things that I feel like is critical for me to communicate with you today, and one of the things that I spend a lot of time on with my patients, is understanding that none of these therapies totally treat or eradicate the problem of the hardening of the arteries. It's much like a cancer diagnosis and treatment many times where, although some cancers can be totally treated and cured, many just go into remission. And so none of these therapies totally eradicate the hardening of the arteries. In other words, lifestyle modifications and medications help slow the process. Stenting is treating that artery from the inside, but it's not changing what's going on in the body otherwise, and you can certainly get blockages that develop either within the area of stenting or in other areas of the heart. And the same is true for bypass surgery. Even though we've rerouted the plumbing and reestablished blood flow so that nutrients and oxygen can get to the heart muscle itself, we haven't done anything in or during that operation that stops the hardening of the arteries itself. The goals of these therapies are essentially the same. Number one, to prevent you from having a big heart attack so you can live longer. Number two, to treat your symptoms so that quality of life improves. And number three, and this encompasses really both of these, is to maintain heart function. By opening these arteries or rerouting plumbing, we maintain the strength of the heart pump itself. And it just makes good sense. Patients with strong heart muscles do much better than patients with weak heart muscles. Why do heart muscles become weak in this situation? Well, if blockages continue or hardening of the arteries continues, then the heart muscle maintains this situation where it's blood starved. It's not getting enough oxygen and nutrients to perform properly, and eventually it will become weaker, and the risks of death go up. Now, every decision that we make in medicine is essentially a risk-benefit decision. Even taking a aspirin or medication for a headache, it's got a small, very small risk associated with it, but that risk is small enough that treating your pain and being able to go on with your daily life is reasonable. It's the same when we make decisions for heart disease, for blockages in the arteries. When you have no symptoms or very little symptoms, we try the least invasive approach first: lifestyle modification and medications. As your symptoms progress or you fail medical therapy, the risk of potentially having a heart attack goes up. That's when you're evaluated for a potential stent. If a stent doesn't work or you're not a candidate for a stent, then the risks of accepting bypass surgery, again, to prevent you from having a heart attack, may be appropriate. Understanding these risks and benefits and how these scales are balanced doesn't make the situation any less scary. But my hope is that by understanding that you're making the best decision for yourself based on the risks and benefits, I think there's comfort there. I think that there's comfort knowing that you're making the safest possible decision given the cards that you have been dealt. My more broad hope in sharing this information is that you learn about this before you're being told by a cardiologist laying on a cath table or an emergency room that you in fact have blockages in the heart arteries, so that you're familiar with this situation, so that it's not a surprise what the options are, and you have a framework so that you have the ability to make the best possible decision in partnership with your doctor to maintain heart health and overall longevity. Thank you so much for your time today. I truly appreciate your attention. If you've been watching on YouTube, you can like and subscribe. If you're listening on Spotify or Apple Podcast, you can leave up to a 5-star rating. And if you'd like to subscribe, you'll be notified of any future episodes so that you don't miss out. We have a free weekly newsletter. If you're interested in doing a deeper dive on any of these topics, please check it out if it's of interest to you. And I hope you guys have a great day.